record button. Okay, so we'll go ahead and get started. Today, I'm very happy to have Dr. Valera join us. She's an assistant professor in the School of Public Health and also affiliated faculty member in the School of Social Work at Rutgers University. She earned her PhD in social work from the University of South Carolina College of Social Work. And she also completed a 3-year postdoctoral research fellowship in human immunodeficiency virus prevention and human sexuality from Columbia University and the New York State Psychiatric Institute, and a 1-year clinical fellowship in cancer health disparities from the Albert Einstein College of Medicine. So without further ado, again, we thank her for her time, and she will be discussing today as part of Hispanic Heritage Month, the importance of language in the context of COVID-19. So go ahead, Dr. Valera.
Hi, everyone. Happy lunch hour. I'm so excited to have this presentation and share some of our understanding of how important language is, especially in the context of COVID-19. So I'm going to go ahead and get started. And so I'm going to focus on a few things. I think it's important to orient the work that we do. And so I'm going to define some terms. I also think it's important to focus on our understanding of why we need to address issues related to language and its implications, and how this may be relevant to factors that impact COVID-19, especially with the populations that we serve and are committed to, and why language is important in the context of COVID-19. And I'm also going to share some best practices. And so just a quick and brief definition of language. So language is a system of communication which consists of sounds, written words, and gestures used by people for talking or writing. I wanted to just give you guys like a quick understanding in that everything that we do, how we communicate, whether it's nonverbal and verbal, we're communicating a sense of understanding, a sense of language in whatever language we choose. And so when we think about the context of language as it relates to health literacy, so health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. And so the operative words here are understand, make appropriate health decisions. So that's, when you start to look at what language is and health literacy, these two terms go hand in hand. And so why do we think about language, right? So why does language matter? So language matters a lot in everything that we do. It matters when we're communicating about health. It matters when we're talking to anyone about life. So the key here is that because language matters, the words that we choose also matter. And especially when it comes to a person's personal topics about health. So, majority of you are in medicine. And so think about how you communicate with your patients, right? And start to think about the words that you choose in helping them understand their symptoms and possibly a treatment plan. So language can do a couple things. One, it can motivate you for action. It could also create fear or panic. So when we think about how we communicate, we can do all kinds of things, but mostly we're going to do something, whether it's like, doing something that's really good for our health or totally panicking. So in our society today, we are totally experiencing a multilingual crisis. And I think the over-reliance on English only in the way we disseminate public health information is very, very challenging. And we saw this in the early days of the pandemic, where people of very different racial and ethnic groups were really trying to locate information that they can understand. And so I'm going to give you guys an exercise, and Dr. Duque, you cannot participate this time because you scored an A+ last time when we did this session. So I want a new volunteer. And so I'm going to sort of do an exercise. And so can someone Rob, read this to me. Oh, sorry. Okay, anyone? Any volunteers? Okay. Dr. Vic-
Odd arose high and comfort. I don't know, it's hard to read.
Who else wants to try? Mercedes?
Yeah, I am trying to read it and I cannot. I can maybe make out the third word, high. I
Yeah,
can't.
Ada put it down in the link to ensure high performance. Keep going, Ada. Periodically. Clean the tape heads and
Well, Ida's doing a really good job. Ida, do you
expand and renew the notion and accumulation of those. Yep, is reversing the reading from right to left. I got it, Ada. You're good at this. To those and
Okay, so Dr. Duque, do you want to volunteer?
It's unfair because I've read it before.
That's
so.
okay, but we're all struggling here.
Okay. To ensure high performance, periodically clean the tape heads and I don't know what that is. Whenever you notice an accumulation of dust and oh, it's like yeah, it's a technical term, right? To particles.
Particles.
Use a cotton swab moistened with isopropyl alcohol. Be sure no alcohol touches the rubber strap. Oh, it actually, I didn't even realize it flips between normal and, oh no, it's
No,
rubber
it's
parts.
touches the
Rubber
rubber
parts.
strap,
The parts.
but it's parts.
Yeah. As it tends to dry and eventually crack the rubber. Okay. Use a damp cloth or sponge or clean the cabinet. A mild soap like dishwashing detergent will help remove
grease or
oil. That it? Because I don't know why my view, I can't see the rest. Oh, let's see.
That's great. So how did you guys feel trying to understand that? Or even trying to read it?
Not good, confused.
You're
Frustrated.
confused. What else? Humberto, how did you feel?
I was trying to, like, after Ada started saying stuff, I go, I saw the process. Like, okay, now I have to read it from right to left to right, right to left. But I think I still got confused again on how to say some of the stuff because it's just, I'm trying to overanalyze it. But then when Luis did it again and then he normalized, he goes, "Oh, this is back to normal." I go, no, it's not. Then I was reading what he was reading, and I was able to get all the end part easier because now you train the brain to just look for those factors.
Well, you guys were trying to read it. Were you interpreting what you were, what was it saying? Were you able to interpret or understand what the context was about?
No, just reading, and it also put in that she was just reading without understanding much.
So I know that Ida did an amazing job. So tell Ida, do you want to share how you felt while you were, reading that and chat, using the chat to sort of help us, understand what was saying? If you're trying to speak, you're muted.
So sorry, hold on. I'm on my computer. I don't have a camera or a microphone, and I logged in on the phone and now I have an echo. Let me kill the audio on the computer. But it was very weird.
Yeah, it was really, it's hard. And so you start to think about like what my patients are thinking about when I'm providing them with, a list of instructions, right? Do they truly understand and comprehend what we're trying to convey to them? And so, with that, we just want to recognize that nearly 9 out of 10 US adults have difficulty using the everyday health information that is routinely available in our healthcare facilities, retail outlets, media, and communities. And so, that's a portion of our patients that are struggling with day-to-day decision-making and how to deal with the medication, the side effects that the medication may have, or some of the symptoms that they're experiencing. And oftentimes people may just decide, I'm gonna take the medication, and if my doctor says, "How are you doing?" I'll just say I'm fine, because they don't want to feel like they're like that the patient is burdening the doctor. And so there are some factors, when we think about how language impacts COVID, there are a lot of factors that may come into play, that interplace with language, and that is, one's education, not just here in the US, but in their host country. We need to understand, what was the level of education that, that they're coming in with, both in terms of their host country, or also here in the United States. We also need to understand, like, in terms of language, what language do people speak, and do they understand that language fluently or conversationally, or can they only read in their chosen language, but aren't able to communicate verbally in that specific language. We also have to understand in terms of culture, what people's cultures are and how people understand, language, and age too. Age is also another factor as well. So, we know that older people may need to be reminded multiple times in terms of how, in terms of whether they understand the medication that's being provided, or the instructions to take the medication. We know that in some places there's children who are translating for their family members in terms of, when they're visiting the doctors and so forth. And income plays a major role in all of these, and it intersects in terms of how we understand people's ability to really make decisions about about health. And so we are hearing, this is really true when it comes to COVID. We're hearing a lot of new health terms and phrases that many of us don't really know. And so what's the latest term when it comes to COVID vaccinations? We're hearing about boosters. We're assuming that the general population knows what a booster is, right? So we use that as a common term, but do we honestly know whether our patients know what a COVID-19 booster is? So Many of us are at risk for experiencing COVID-19. All of us have a personal relationship with COVID-19 and are really struggling to understand and navigate the healthcare system. That's, just trying to get COVID vaccinations, trying to get an appointment. And if you have COVID, learning that you may be eligible for monoclonal antibodies, which a lot of people are really not aware of, as we know. It's important that health information is easy to understand. And so we know how to protect ourselves and how we should seek care. And health literacy approaches may help us understand and act on health information we receive. And I don't know if you've noticed that I'm using terms like we and us, because at the end, because language impacts all of us, not just our patients or the communities that we serve. Language is part of us. And so, when we hear terms, we may need to Google that. We have the ability and the technologies to use Google to understand that. But even if my grandmother uses Google and wants to understand what a term is, she may not even really understand that because she doesn't speak English. So that's really a really important thing, is that this issue around language is very relevant to every single one of us. And so, can anyone just tell me, here, this was a New York Times article about flattening the the COVID curve. Can anyone sort of explain this in layman's term?
So that means that without protective measure, many of us are going to get sick in a very short period of time, and the healthcare system is going to collapse. While if we use protective measure, even though the same amount of us will get sick, it will be through a much longer period of time, so that the healthcare can take care of us, because we're doing it in a slower pace.
That's excellent. What is protective measure?
Protective social distancing, wearing a mask, washing your hands, using hand disinfectant techniques, not hanging together with people that you don't know, having a bubble, which is another term that we started to use also.
Yeah, so even the terms that we are so used to, saying, like protective measures, the assumption is that everyone knows what protective measures are. In our bubble, yes, we all know what protective measures are. We see this infograph, and yes, we get it. It takes us a matter of seconds to understand that if you are, with protective measures, you slow the use of healthcare resources. Without, it starts to increase, the number of cases increase. But not so. This was published at the New York Times, which is basically a newspaper that we all read, but not everyone understands this image, right? And so we need to start thinking about our messaging. How do we simplify our messaging that limits the jargon that we're using for all people? Because this here is really geared for people that are, fairly educated and probably in the medical field, right? So let's start to percolate on that. How do I message the information so that everyone can understand what I'm trying to say?
So you could have, in my opinion, you could have used, for instance, for the first curve, you could have used a time frame, let's say 3 months, and then draw a number of little figures there without a mask.
Mm-hmm.
Right? And then have another one having 6 months or a year, having the same amount of people, but spread in time by wearing masks and washing hands.
Yes.
So visuals will work better for people that are not educated on how to read a graph.
Right. So here's an example. So this is a meme I'm sure that all of you have seen, and it says, "The doctor told me to watch my eating." So some people take that literally, right? So what does it mean? The doctor told me to watch my eating. Well, this image is basically this guy is eating whatever he's eating, and he's watching himself, right? So even things like that even those type of directions can be misunderstood, right? And we think that, oh my God, I can't believe this guy is doing that. But it's actually telling us a whole lot, that we assume that our patients really get what we're trying to say. And this image, there's a lot of these images that are out there, like people are
Cutting the alcohol with the scissors as you pour it,
yeah,
or yeah, it's a lot of that.
yeah, but it's true though. Like, this is how it's interpreted in many ways. It's funny for us, but I imagine that there are people out there who are actually doing what they're literally told what to do. So there could be misunderstanding of medical instructions, which is really important. So, like there's sometimes you have a prescription that says you take 3 times a day. Okay, like when do you take your medication 3 times a day? Do you take that one in the morning, one in after lunchtime, during dinner? Do you take it with water? Do you take it with meals? So being very clear, and then asking our patients or our clients, like, what am I what am I trying to say here, and have them report back what they, what's being said. And so I just want to share some best practices. So really important, we tend to generalize our, and over stereotype the population that we work with, because that's just human nature. We tend to say, well, I guess all patients are in this fashion because they fit this demographic and so forth. We want to avoid othering or stereotyping the people that we're working with. We want to start to use first person language. So this is extremely important, especially for people that have vulnerabilities. So, we want to avoid terms like inmate or offender or substance user. We want to basically say a person who's incarcerated, person with substance use issues. Things like mental illness, like the person suffering from mental illness. We want to say the person suffering from mental challenges. There's a lot of us who are starting to move towards using first person language to humanize the condition that people are experiencing. You want to create health information in local languages. So this is extremely relevant, especially if you have a diverse group of people that speak multiple different languages. You want to understand the culture of the people that you're serving. Avoid things like frontline corona warriors. We saw this a lot during the early pandemic. We were calling our front lines warriors, defenders of healthcare. You want to start to avoid that, because what it does is it's sort of others, the people that you're serving. You need to synthesize, or we need to synthesize information in plain language. And then plain language, we have basically, I think it's important to really ask our patients, what does plain language look like for you? Because it could be very different from another group of folks. Science communication in preferred languages is totally missing in our system. During the early days of the pandemic, there were just very little information out there for a lot of different groups to really understand how to protect themselves from COVID. And so we need to find a way to communicate our science in people's preferred languages in a simplified and plain fashion. I added this today. I think we should strive for simplification. Honestly, like, I think what I'm reading, what you all are reading, are just too scientific, that it's very hard to convey the information to the people that we're working with and our patients. I would prefer that we sort of reduce the medical jargon. That it's great to use medical jargon in our community, but not all of us are in the same community. We're working directly with multiple people with various different languages and various different conditions. I love using diagrams and pictures. I'm a picture person, so I think that's so important, but we want to make sure that those pictures are also very relevant, and keep the text short and simple. So again, really pushing for simplified language, asking folks to report back and saying, does this make sense to you? Do you understand this? And I would honestly just start with defining our terms and making sure that we all speak the same language and how we understand a phenomenon. And is there anything else that you all might want to add?
So I see, I'm a pathologist, so I don't see patients. alive patients, that is. But I have to tell you that I have a lot of friends and that call me because they went to the doctor and they didn't understand what's going on. And so I kind of had to act as a translator or a liaison to that doctor in a sense, because what is being given to them. And my advice to them is always when you go to the doctor, you need to take all of your questions written down on a piece of paper until you understand them fully. It's not that you bother me by calling me, it's that you need to understand from your doctor. I'm not your and like encouraging people to have a mammogram, and like I always do the graph for the colonoscopy, how long it takes for a polyp to become cancer. In times I said, this is a little polyp. If you go now, get that thing off your butt, you get these done, and basically you're cured for 3 more years. So I use a lot of these to encourage my friends and family members to, so that I think if they understand, and it's not instilling fear. We know that instilling fear in people, how long we've been telling people that if you smoke, you get lung cancer, right? What we can tell them is if you do these now and you have nothing, you don't have to do it for 7 or 10 years again. I mean, if you do, which is not likely, then it's 3 years. But if you do it now, it's 10 more years. So you kind of, I at least try to like put a good light on it and have a successful outcome. And then telling them, well, if not, then, I think people react much better to being successful to having a failure. So, but I can see how people have no idea when they come from the doctor what happened. And I always tell them, if you had a biopsy, make sure, if you want me to help you, make sure you need to get a radiology report, a pathology report. Otherwise, I cannot understand what you think your doctor told you. And I can see that every day I deal with this, with family members or friends of friends. And so I can see how this is a big problem.
Hello, can you hear me?
Yes.
I can tell you a funny story. A few years back, my husband had a fall, and he is a physician. He broke his arm, and we went to the doctor together.
I
And
thought he
he
was
had
Humpty
next-
Dumpty.
And we went, we got everything done, and the doctor explained, and he got a sling, and we got here. And he says, what did he say? And I said, I don't remember. So, and we're both physicians. So we were laughing and we said, oh my God, imagine the patients, because we could not remember. We said yes to everything that was told to us. We understood at the time, but by the time we got home, we have forgotten.
Wow. That's a major issue. Because at that moment of interaction, you as a physician understood what was being conveyed. And then the moment you left the interaction, all of that information has been forgotten or just,
Yep.
memory.
Mhm.
I can't, yeah.
I know when I see patients, I work at the FQHC, Luis, I'm internal medicine. And when I see patients at the FQHC, I generally carry like maybe 70% Spanish speaking patients, and a good percentage of them are sort of like elderly or, and they'll yes you to death. You talk to them and they'll say, yes, see, doctor. And then at the end, I like to ask like, okay, so what is our plan? And that's when you see sort of like deer in headlights, like, oh, like you're sort of quizzing me. Like and some of them are able to write and I can clarify. But a lot of them, we just have to, again, go over, and then you could see like, okay, not, they start engaging. And so, that's something that I notice a lot.
Yeah, I think it's a really pressing issue, is how much does our patients really understand, upon upon receiving in the information, and then when they leave, and then who are they calling to get clarity in terms of instructions? I mean, Ida, your family, friends of friends are very lucky to have you because they have you as an advocate and that can really help them and understand and interpret these instructions. But, for the majority, it's really just trying to make sense and piecemeal about what to do next.
Oh, it's incredible. Oh, and also, even just talking to a person that speaks Spanish from a different country, what
Mhm.
I'm saying could mean so many different things to them, depending on where you're coming from. So if you use the word oloroso with a Cuban person, it would say, "Oh, you smell really good." If you use it with an Argentinian, it may mean that you're smelly. I mean, can you imagine? So it's frustrating.
Yeah.
I agree.
Oh, there you go. The Argentinian spoke.
An Argentinian. Yeah.
Dale, Diego, di algo.
Che Diego.
Yeah, oloroso is not very good.
Right, but for us, if you said, "Oh, qué oloroso," that means, "Oh, you smell good." I know that because I have an Argentinian boyfriend, and the first time I told him, "Oh my God, you're oloroso," and he's like, "What do you mean? I just took a shower." I'm like, "Yeah, that's exactly what I mean." So we're like, "Okay, what do you mean in English?" I'm like, "You smell good," and he's like, "Oh yeah, okay."
That's why it's, it's listed here. You want to create health information in people's local languages because the way it may be translated in another language, it could be very, very different, and people might get offended by what you're trying to say or just completely ignore what's being said. So I'm going to move right along. So here's some other examples of best practices. So you guys have, all of you here are pretty much in the medical and public health field. So, instead of using things like diet, making assumption that we all understand what that is, maybe using words like what you eat, terms like contraception, maybe just using things like birth control, or, the term, benign and malignant, right? So people think, it's benign. They're like, what is that? Let me use my phone, or let me get somebody to translate that. Just saying things like, it's not cancer. So
Even, I'm sorry to interrupt, even by using the terms negative or positive.
Yeah.
I don't know if any of you saw the Seinfeld episode where George gets a biopsy and he was negative and he thought he had cancer and he was dying, but negative meant he didn't have cancer. So that negative, it's good in medicine in some instances, but I mean, yeah.
Yeah. What else? What else can you think of to simplify just, our basic understanding in terms of health? Like, so let's just use diet for an example. You could use things like what you eat. Is there something else, some other way to express the same with, in a more simplified way?
Your meals or the food that you eat, or again, depending on who you're talking.
Yeah. Yeah. So it's almost having to translate what we know, to be true in a way that will make sense in interpretation. I have other examples here. Where's my mouse? Okay. I'm trying to move to the next slide. Okay. So here is another, this came out of a study. It's an example of the jargon that a lot of our field, especially in science uses. I had a really hard time understanding any of this information. And so I just wanted to basically showcase that even most of us who are in the, who have been highly educated, in medicine and public health or biology or what have you, still have a hard time distilling information that we recognize, right? So so for me, this looks like gobbledygook for me. So I imagine for our patients or our clients or whoever have you, when they're provided with such too much text and too much information, they probably need to spend a really, quite some time distilling and understanding what's being said word for word. So I would strive for simplification. I would try to probably explain a lot of the terms that are being used here if I had to explain this to a lay audience. So this was published at the AmericanScientists.org, and it's about how to write, it's about scientific writing. And so when we look at our science and it's peer reviewed, it's published in these journals that the people can't access because they don't have any subscriptions to a lot of the journals that we subscribe to, like the New England Journal of Medicine, or they're not open. And so even if they wanted to get information about things like about COVID, if they don't have a subscription, if they can't afford to pay like $60 for a journal, no one's going to pay that. They're basically dependent on information that's out there in social media, or what's out there by when their peers are sharing that information. So I just really want to emphasize that we need to strive for simplifying our science, regardless of what science it is. And so here's some other things. Make sure we do try our very best to do no harm. And I don't think anyone here would be thinking that, but like, when back in early in the pandemic, we used terms like the Wuhan virus or the China virus or what have you. And those things can stigmatize a segment of the population. And so
How about Kung Fu virus?
Yeah. And so we just want to make sure we try to limit those stigmatizing language so it doesn't further isolate or discriminate a group of people. And we saw what was happening in the Asian community, where they were being attacked by society and by people because people thought that they were the cause of the SARS-CoV-2. Instead of using things like quarantine, which we use all the time, maybe use the term separate. You just want to separate for a little while. Instead of using the term infected with, affected by, these are just things to think about. And then I'm really pushing hard to tell people that we need to stop othering. It's not about them or they, or it's we are all in this together. We're struggling very differently. Our experiences are different, but COVID is real. We're experiencing climate change. All of us are. And so it has to be a we-ness approach as opposed to a they approach. I would try to, even change the way we think about social distancing and maybe just simplify it to say, don't get too close to people, right? So how would you say new variant? Like, how would you change that into more of a local term where people can understand? What would you use instead of new variant?
I don't know if new strain can be used. New strain or I don't know.
Type,
Go ahead, Dr. Duque.
like a new type.
How would you explain that to your grandmother? A new variant? Or to an uncle? Or an aunt? Or a 5-year-old?
A virus that has changed shapes and is now become more aggressive. Or a virus that became crazy. I would say that. Or a virus on steroids.
I can see that. What else would you use?
I would say a more dangerous virus
Mhm.
without saying that it's a new strain, it's a new variant, it's a new virus, and it's more dangerous. That's what matters.
Mhm. What about the vaccine? How would you say that in a simple way?
A shot that protects you from the virus.
What else?
A long-term medicine that will protect you from the virus.
What about a medicine so you don't get too sick?
Yeah.
Or you don't, that's what I told, my daughter just got the flu vaccine and she asked me what it was and I said, it's medicine. So when you get sick, you don't get too sick or you don't get the flu. She said, okay. And then I said, now you have superpowers in your body to protect you from the flu.
Yeah.
So it's taking a little bit of additional time in having to explain our terms. And it may take a few minutes, it's really taking that time to say, I'm going to explain these terms and I'm going to hopefully have you report back or explain to me what you're understanding. And that's, it's just trying to do that for every patient, I think is very hard to do. And I think this is where we need to start to think about what approaches can we use to help, decrease some of these misinformation and also provide accurate information to the people that we care about. And so things like contact tracing, right? Everyone here knows what contact tracing is, but for the most part, it wasn't really completely defined when we started using it, right? So, when like my mom got a call from someone because she ended up getting COVID and she hung up on that person. And I said, who called you? She's like, someone's calling me because they want to know when I got COVID and who I was with. And I said, that's a contact tracer. She said, what is that? Like I've never heard, she's like, I've never heard of that term before. And I said, and she said, they have to stop calling me. I'm not going to answer the phone. So so in order for us to really be helpful as, in the field, we have to try to make our terms easy to understand. So the way, the way I explained what contact tracing was to her, I said, this is a way to identify people who have or may have been around a person who is sick. So you're going to get someone probably from DOH or, who's going to ask you these questions because they want to make sure that they contact other people who you were exposed to. And, she didn't know what a coronavirus was. And I said, it's just a group of germs that cause people to get really sick. And, these are the kind of things like, she like having to really think about, does she understand what she's saying, what I'm saying? When she gets very sick, will she be able to go to the hospital and communicate to the doctors what's happening with her? And a lot of times the problem for many folks in our community is that they're not able to communicate and articulate what's happening to them in a way that we would like them to be. And it's because they don't have the right understanding of the symptoms or they do have the right understanding, but they really can't communicate it in the way that we want them to. So there's a mismatch in communication. And so I just wanted to share this too. So you want to show, use images to be able to explain some of the things that we want. Sometimes we have to, not only do we have to show images, but we may have to point to the organ that we're looking at and, and just draw diagrams and make it a point that things are very clear. And, images that have very simplified language and information that says, here are the primary symptoms of COVID-19. And here are here are some examples of severe symptoms. And if you have any of these symptoms that gets to be very severe, you want to be able to call, go to the ER, call your doctor, etc. So, these kind of images are very important for people that are, that need additional information that's very basic and simple. So we did a video, and I don't have the time to actually show the video, but this is it's a video that basically provides people the understanding of originally what COVID-19 was. And so we had it's a very short video, 3-minute video that walks someone who is Spanish speaking to, it introduces them to what COVID is, and sort of even provides them with like, a description of what does 2 feet distance look like, because some people may need that visually. And so it's a really great video. We have a second one now to talk about vaccination. So showing images, showing videos, making it very simplified, and also assuming that, you want to make sure that you have captions too. So people are reading, the what's being said, but also hearing it at the same time. And then I wanted to just share, I'm gonna skip here. So the other thing I wanted to note is that you want to make sure you have use images and language that is local to the community, and that is important for them to, to see what these types of images look like, and what instructions you're trying to convey to them. So all of these images I was able to take from the CDC. They've done a very good job in really trying to explain to the public, what 6 feet distance is, wearing the mask, etc., and making sure you get vaccinated when you can, washing your hands. So they've done a really good job tailoring the message to the local audience. And then I just want to leave you all with this. So what I hear, I forget. What I see, I remember. But what I do, I understand. And so it's not enough to just hear what's being said. It's not enough to see. It's being able to understand what's being heard and what's being seen are critical for us to make appropriate health decisions. So I'm going to end there. I'm going to stop sharing my screen and leave it up for questions. Any questions?
I'll just say what I said on the chat, which is obviously, full disclosure, I'm involved in I didn't realize that that the video we translated, or not translated, but 6 feet into meters.
Mm-hmm.
And I think that you could have easily translated to 6 pies, 6 feet, and not realize that a lot of people will not have sort of the background to be able to say like, oh, what is actually like feet, because they're just more used to the metric system. And so I thought that was interesting.
I think my task for all of us is to just familiarize ourselves with the documents that we have and the messaging that we share with the populations that we work with, and see how we can improve by simplifying the jargon, and by simplifying and making things more, easy to understand, and having more images, more of those things. Because like many of us have said here, is that when we see, people are coming to us, we think we understand what's being told. And then when they get home, or when they leave your encounter, it's they forget. And so how do we just try to make our everyday just more simple, And I think that's the hard part, is even our science, like even our science to be more, more plain language, or be able to translate that to the community, because people are looking for information. People are looking for information about their health, about the COVID, about boosters, about all these things. And what's out there is not what we want them to have, or, that it's just people are dying because there's all this misinformation out there, but we're not out there providing the information that people need. And I think we need to be more, more central in providing and prioritizing the way we do our language, our common scientific language.